students, welcome back to our channel Ach'z. So today we had IELTS and OET exam, and IELTS review already updated, and this video is about the OET exam review. So 22nd February 2025. So those who already written their exam, try to comment about your experience, and we are going to share the available question paper of the day. So from India, GCC, and also from the European countries. So if you got any other question booklet, means again try to mention and also share your experience. So we will start from the first module reading. In that the set 1, the part A was about biliary disease. In that the test A includes overview of biliary disease and also about the other name PFIC. It's a rare genetic liver disorder. Test A including overview of this biliary disease, and the test B about the types and the causes like PFIC 1, 2, 3 like that, and the test C including diagnosis and treatment, and test D about the prognosis and management. In that the C1 and C2 including hospital policies and managing in the pediatric patient, and guidelines for genetic testing and advances in treatment. So I will release this particular passage. That means whenever there is new passages or the extract, we will release as the form of mock test in this particular channel, so you can freely access to that. You don't want to pay to that and all. So I will release this particular passage tomorrow or within 2 days. Okay, so you can just practice from that, those who are planning to give your exams in the upcoming days. And in the second set, asthma, that was the passage, and the test A including guidelines for asthma management, test B with asthma inhaler usage leaflet, and the test C about the research study on air pollution and asthma rates, and the test D about a doctor's case note for the asthma patient. In that the C1 and C2, the psychological impact of long-term hospitalization and oxygen therapy. Okay, so we already created a playlist for this mock test, and recently which all are the new passages like the botulism and all, we already updated over there. The only thing is you need to subscribe, then only you will get notification about the each and every releases, or else you need to check out in between. Now coming towards the third set of reading, the part A about sickle cell disease like SCD, the part A or the test A about the definition and overview, test B about the causes and types like HBSS, HBSC, HBS like that, and the test C about diagnosis and treatment, and the last test about complication and future research. And in that the C1 and C2, hospital policy about the blood sugar testing, and the role of AI, artificial intelligence, in diagnosing diseases. So that's about the 3 different set of reading question booklets which we collected from students. So if you got any other question booklet, means try to comment that below. So what all things you remember, okay, in detail. Now coming towards the second module, speaking. In the first role play card, the setting was a hospital ward, and the scenario, a patient recovering from knee surgery and anxious about pain and mobility. So you need to reassure the patient about pain management options, explain the importance of early mobilization for recovery, and provide guidelines for safe movement and when to seek help or when to come back to the hospital. And in the second role play card, setting is emergency department, and about the scenario, a parent has brought in their child with a fever, so fearing it could be meningitis. So you need to calm down the parent and explain the assessment process, reassure them while also explaining serious symptoms to watch for, and provide guidance on next steps and possible hospital admission. And coming towards the third set of role play card, the setting is outpatient clinic. The scenario, a patient with newly diagnosed type 2 diabetics is struggling with dietary changes. So you need to explain the importance of a balanced diet in diabetic management, then provide simple meal planning tips and all, and address if there is any misconception about the sugar intake or carbohydrate intake. And the fourth role play card, the setting is emergency department. The patient is suspected with heart attack. So the patient is 60-year-old man arrived with chest pain and shortness of breath. So he is anxious and afraid. So you need to calm down the patient, explain the importance of this immediate care, ask about the medical history like the diabetic, smoking or hypertension like that. And also you need to explain the patient that the doctor will come and do some test like ECG, blood test, and also you need to reassure the patient. And we will move on to the fifth set. The setting is postnatal ward, and the scenario is the first time mother is struggling with breastfeeding and is considering switching to formula. So your task is to encourage her and explain about the breastfeeding benefits, teach proper techniques to reduce the pain, and also reassure her that it takes time and suggest seeing a lactation consultant. So that's about the fifth one. And the last card, the setting is pre-operative unit. The scenario is like 35-year-old woman is scheduled for appendectomy but is nervous about the procedure. So you need to explain the surgical procedure and what to expect and address her anxiety by explaining the anesthesia procedure and also about the pain control measures, and reassure her about the post-operative care and the recovery time. So that's about the 6 different role play cards which we collected from today's exam. That is from different centers. Okay. Now coming towards the next module about the writing section. In the first set of letter, it was a referral letter. The scenario, you are a community nurse visiting Mr. Alan Robert, 75-year-old man with a diabetic foot ulcer on his right foot. And despite regular dressing changes, the wound is not healing well and there are signs of infection. So they just clearly mention the patient name, year, medical history like type 2 diabetics, and it is poorly controlled, and the patient is having hypertension, and the current issue like diabetic foot ulcer, increasing redness, swelling and all. And in the current treatment, regular dressing changes and also oral antibiotics. And the present concern is possible infection and also the need for the specialist review. So you need to write a referral letter as a community health nurse to the wound care nursing. Now coming towards the second set of letter, it was a discharge letter. So the setting is you are a hospital nurse preparing a discharge letter for the patient, and they just given the patient name and the year. So the patient underwent total knee replacement surgery and she is being discharged to her GP for the follow-up care. And in the case note, they clearly mentioned the reason for the admission, the post-operative progress. So in the post-operative progress, they mentioned there is no any complication, but there is a mild swelling and all. And in the discharge plan, the continued pain relief, physiotherapy, and also the wound care. And the follow-up needed like the stitches removal in 10 days. So the GP want to monitor for any pain or the mobility. So you need to write a letter to the GP. And in the third set of letter, it was a transfer letter. And the scenario is you are a hospital nurse transferring a patient with 72 years old to a rehabilitation center following a mild stroke. So in the case note, they clearly mentioned about the patient condition and the hospital stay is 7 days and the condition is stable now. And the rehabilitation plan, further physiotherapy and occupational therapy. So the current status, the patient is walking independently and but having mild weakness in right hand. So you need to write a letter to the stroke rehabilitation center. So that's about the 3 different set of letter which we collected. Now coming towards the last module, listening. And in the first set, the part A including a listening to a consultation between a general practitioner and a patient. It's complaining for the chronic back pain. Okay, so you need to complete the notes and all. And in the part B, it was about the talk between hospital administrator and a new staff. And to the part C, it was a lecture on the latest development in cardiac surgery techniques and all. So you need to understand the content. And coming towards the second set of listening, the part A like listening to a patient describing the symptoms of respiratory infection to a nurse. And part B, it was about the talk by a physiotherapist and to the patient about the post-operative exercises. Coming towards the part C, it was a podcast related to the challenges of managing the mental health in the rural communities. And the last set, third set, in the part A, it was an interview with the patient about the experience of the physical therapy after the stroke. And the part B, it was the talk by the senior nurse and the junior one. And the last one, it was a seminar about the infectious disease and also the public health responses. So that's about the content. So I hope you cleared about the trend, what is going on. So that's why we are making a detailed review about each and every module to let you know about the trend and what to expect in the upcoming days. So I hope these videos will help you out. If it is like that, means don't forget to subscribe and click on the bell icon nearby. Then only you will be notified about the recent update and all. So as I mentioned before, the new reading releases we will update in this channel only in the form of a self-preparation material or in mock test format. And if you need the writing samples for all the things, all the questions which we are discussing over the review section, we will release the sample for that in our Facebook page in the same name only, Ach'z. In that page, you will get the sample OET letters. Okay, that with the high score, so you can just cross check over there also. So all the very best for your results and also those who are planning to take your OET exam soon. So God bless you all and stay tuned.